The recent revelation that the BBC is allocating a significant portion of its license fee revenue towards private healthcare for its staff has sparked widespread outrage. This move, which will cost the public broadcaster £650,000, has been met with strong criticism and calls for the license fee to be abolished. The BBC plans to award a contract to a private healthcare provider, offering remote GP appointments to employees and fixed-term workers via online or phone consultations. This scheme, set to run from February 2026 to January 2029 with a potential extension until 2031, has drawn ire from critics who argue that it is unjustifiable for the public to fund such a service while they themselves face lengthy waits for NHS appointments. "It's indefensible," said a TV industry source. "When the public struggles to secure a GP appointment, our license fee is being used to guarantee BBC staff can access one whenever they desire. It's a mockery of the situation." The timing of this revelation is particularly sensitive, as it follows news last week that waits to see a GP have reached an all-time high, with over 12.9 million people waiting more than 28 days for an appointment in the first half of the year, compared to 4.5 million in 2021. The NHS has also warned of waiting times of up to 18 weeks for non-urgent, consultant-led treatments. William Yarwood, media campaign manager at the Taxpayers Alliance, added, "It's outrageous that while millions are unable to access GP services, the BBC is using license fee money to fund a private healthcare system for its staff. This two-tier system, where viewers are forced to pay for privileges they themselves cannot enjoy, is a stark example of the BBC's disconnect from the public." Most read in The Sun. In response, a BBC spokesperson stated, "As a 24/7 global media organization, many of our teams operate on irregular schedules and in locations where NHS access is limited. We provide remote GP access as part of our duty of care to reduce sickness absence and ensure the continuity of our services for audiences. But here's where it gets controversial: is it fair for the BBC to prioritize the health of its staff over that of the general public, especially when the license fee is funded by the very people who are being denied timely healthcare? And this is the part most people miss: by offering private healthcare, the BBC is essentially creating a two-tier system, where those who can afford the license fee gain access to privileges that are out of reach for many. What are your thoughts on this? Should the license fee be scrapped, or is there a way to ensure that the public's money is used more equitably?